how can practices train their staff to handle collections effectively and sensitively, especially when they might be dealing with a patient that's experiencing a financial difficulty?
Yeah, and there's a couple of things that we haven't discussed, and there's a difference between like sort of dealing with insurance companies that haven't paid you and still what to do about the patient collections. You know, there are people that charge before the visit at the moment of scheduling that have their patients submit a credit card payment to cover the costs of the visit. Again, this gets complicated because if you're using bill codes correctly, the charges can be different. And so if you're collecting something ahead of time, it might not always match, or people adjust their billing practices to meet what was charged, which in general is not the correct way to do it. You need to perform the service and then see what the charge is going to be. But I definitely understand the collecting a payment up front to avoid having to deal with it's usually a small percent of patients who don't pay, but it is still are going to be a percentage of patients that don't pay if you don't charge ahead of time. And that takes time and energy and is uncomfortable. So just wanted to point that piece out. From research in patient payments, we know that it is in everyone's best interest to offer payment plans and to be quick to offer payment plans, and being able to make the payment plan something that's very affordable for families and know that your clinic offers it is very helpful. Avoiding the ease of text messages and email messages around overdue payments and having an empathetic human voice. I think if you have office staff that come to work at mental health practices usually are kinder, gentler people. And so making sure that when someone is overdue on owing money or keeps leaving the office quickly without giving their copay, you're going to be empathetic, try to catch them. Hey, I noticed seems like you're having a hard time paying. Can we tell you about our financial aid process or payment plans? I think that when it gets to a point where and every clinic would set a different dollar value that someone owes or a number of sessions. But when it gets to a certain point, you have to let the practicing clinician know that the patient is overdue on payments, because ultimately you're not going to be able to keep seeing people that don't pay for the services. And then all clinicians, all mental health clinicians, hopefully have the skills to talk about that uncomfortable topic, but in a direct and empathetic way with your patients.